Hello, and welcome to the FY26 MemorialCare Community Benefit Grant Program. MemorialCare is a nonprofit integrated health system covering both Orange County and LA County. And we have four nonprofit hospitals: Long Beach Medical Center, Miller Children's and Women's Hospital, Orange Coast Medical Center, and Saddleback Medical Center. This slideshow and video will walk you through how to complete the Community Benefit Grant application, the resources you will need in order to be successful in the application, and some details regarding the timeline, funding criteria, and what we're looking for from your organization as it relates to the application itself. We'd like to thank you for your interest in the MemorialCare Community Benefit Grant Program, and we thank you for doing the great work in the community as a nonprofit organization for the individuals you serve. For the grant program eligibility, who's eligible to apply? The hospitals provide financial support to local nonprofit and public health and human service organizations that serve vulnerable communities in our Los Angeles County and Orange County service areas. The grant projects must align with our implementation strategy, health priorities, based on the community health needs assessments available on our website. Only nonprofit tax-exempt organizations and public agencies are eligible for funding. Criteria for funding is for projects that benefit underserved community residents and address health disparities. Also for projects to relate to one or more identified priority health needs. Across our health system, we have access to healthcare, behavioral health, chronic disease, overweight and obesity for Orange Coast Medical Center, pregnancy and birth outcomes for Miller Children's and Women's Hospital, and preventive practices. This is a table of the service area for our Long Beach Medical Center. So if your organization provides services to any one of these cities, you are eligible to apply for the Long Beach Medical Center Community Benefit Grant Program. The zip code specifically does not pertain or apply or preclude you from applying to the grant. This is the Miller Children's and Women's Hospital service area. This is the Orange Coast Medical Center service area. And this is the Saddleback Medical Center service area. So again, if your organization provides services within any of the cities listed on the service area, that is the hospital in which your grant application will apply to. So if your organization provides services in the cities of Dana Point, Ladera Ranch, Laguna Beach, Laguna Woods, Saddleback Medical Center service area would be your grant application. If your organization provides regionally across the county, please identify which service area and hospital your grant program will fit the best. We'll only consider one application per organization per hospital. Health equity we define as a principle, meaning that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. Health equity means reducing and ultimately eliminating disparities in health and its determinants that adversely affect excluded or marginalized groups. We also use the term social drivers of health, where are the conditions and the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. Economic stability, education, healthcare, neighborhood and built environment, social and community support are just a few examples of the social drivers of health. So the FY26 MemorialCare Community Benefit Grant Program is fully online on our website. Each MemorialCare hospital will award 4 grants of $12,500 each. And as stated, an organization may only apply to one MemorialCare hospital. Multiple hospital requests will not be reviewed. So in other words, as I mentioned, If your organization has service areas that overlap multiple hospitals, we will only review one of your organization's application. It is your responsibility to determine which hospital you would like to apply for based on your organization's project. Within your application, you will be asked to list measurable objectives. For example, the number of persons served, the change in number served compared to a previous period, the change in health status, self-reported change in health knowledge or behaviors, perhaps a change in utilization of services, or benefits to the participants made possible by the program or project. Your project budget. We are asking you how you are planning to spend the grant money you are requesting. The grant is for project funding only. We will not accept applications to fund organizational operations. We have a template that we have prepared and provided to you, which I'll show you shortly. Do not submit your organization's annual budget. Rather, you'll download the budget template, fill it out, and use it as an attachment to the online application. And if your organization is working with the fiscal sponsor, we are happy to work with the fiscal sponsor. Funding conditions. You will be notified in writing if your organization is funded. We will ask you to sign a letter of agreement. At that time, we'll have the first installment of the grant funds distributed. And then the second installment will be distributed at the midterm reporting period upon successful completion of the measurable outcomes at that reporting time. The virtual grant application is embedded on our website, as I shared. While completing the application, you are unable to save your progress and return to the application later. Be ready to complete the online application in one sitting. And when you submit the grant application, you will receive a system-generated acknowledgement. If you need help, you can contact Melissa Beal at melissabeal@bealconsulting.com. All of this information is listed on our website as well. So tools for success. When completing the community benefit grant application, we have these templates and resources available on the website for you. The first tool for success is we've created a community benefit grant application question and response tool. This is a fillable PDF document to draft your application responses. You will not submit this document as an attachment. Rather, it's a PDF version of the application with all of the questions, and you can draft your responses into that PDF document and save them there. So that way you can work on this over, several days or throughout the day, and you're not worried about staying in the online application. Number two, download and complete the community benefit objectives and outcomes template and budget template. These are fillable PDF documents. These you will submit as documents as attachments to questions number 7 and number 8 in the application. And I'll show you these templates and how to fill them out and where you can submit them in the application. The timeline for the FY26 Community Benefit Grant Program. On June 12, the grant application will be posted on the website. On August 11th at 5 p.m., the grant applications are due. From August to October, the grant applications will be reviewed by staff and the community benefit oversight committees for each hospital. On Monday, November 3rd, grant acceptance and declination emails will be sent. And then the midterm grant reports will be due on March 13th, 2026, with the final report due July 17th, 2026. And if your organization is selected as a grantee for FY26, you will be reminded of all of these deadlines for the midterm and final reports. And now to the grant application. So here we are on the MemorialCare Community Benefit website. You are on this page if you are watching this video. And we have listed several sections that go over several, of the items we just spoke through on the presentation slides. But as stated, the FY26 Community Benefit Grant is open. The eligibility and restrictions. The Community Benefit Grant criteria. So applicants must be established community organizations. Projects must benefit underserved community residents. Projects must be directly related to one or more of the identified health needs prioritized in the respective hospital's FY26 to FY28 implementation strategy. Please see implementation strategy for each hospital below. And I'll show you those in just a moment. Funding should demonstrate how you will address the social drivers of health. For example, food insecurity, housing and homelessness, etc., and health equity in conjunction with a priority health need. Funding can only be used for project support. A project budget is required. If an applicant is using a fiscal sponsor, as I shared, we can work with the fiscal sponsor to coordinate the grant funding. And applicants may only apply to one MemorialCare hospital for grant funding per grant period. Community benefit grant funding is not awarded for operational support not directly tied to the project. Arts programs or cultural events, athletic programs such as sports teams or leagues, fundraising activities, annual fund drives, building or capital campaigns, individuals, religious organizations, political campaigns, or startup projects. As discussed, we do ask for measurable objectives and outcomes. The measurable objectives and outcomes are very important because it helps us understand what your project is going to achieve and what you are setting out to do. Objectives are the specific steps that lead to the successful completion of the project goals. Completion of the objectives results in specific measurable outcomes that directly contribute to the achievement of the project goals. An objective is a specific result the project is trying to achieve. Examples of objectives include improved health status, increase in access to health services, access to mental health services, and decrease in food insecurity, and the like. An outcome is a detailed measurable statement that outlines the result of the program for the participant. Examples of measurable outcomes include the number of persons served, the change in persons served compared to a previous period, increase in availability of healthy food, self-reported change in health knowledge or behaviors, etc. As stated, funding conditions, we will notify organizations on Monday, November 3rd. If you are going to be a grantee for the FY26 grant period, and you'll also be notified on November 3rd if you are not funded. So I understand it's a little bit of a wait from the time you submit your application to when you are made aware, but we appreciate your patience. And we will have you complete a signed letter of agreement, and we'll then issue the first installment of the grant funds. And then at the midterm report in March of 2026, we'll distribute the second installment of the grant funds. At the midterm report, your organization will need to demonstrate the successful accomplishment of the project objectives measurable results in that reporting period. So the submission for the grant application is due August 11th, 2025 at 5 p.m. For further information, please contact the following representatives for each of these hospitals. For Long Beach Medical Center, Miller Children's and Women's Hospital, and Orange Coast Medical Center, you can contact Melissa Beal. For Saddleback Medical Center, you may contact Ronit Cooper. And these are for questions regarding the grant application. So application instructions. You'll see some PDF items here. These are the templates and the questions and response tools that I referred to during the slides. So tools for success. Number one, the Community Benefit Online Grant Application is an electronic online application embedded on this webpage below. Important, Responses are unable to be saved while working in this online application. We advise you to prepare the responses to the questions in a separate document and copy paste the responses into this online application. Responses include a 2,000 character limit, and that also includes spaces. And the fillable PDF tool of the application questions has been prepared for you, and it's listed here. Again, you are not going to submit this document into the application. Rather, this is a fillable PDF that has all of the application instructions, and you are able to fill in the blanks for your question responses, and then use this as a space to copy and paste into the application itself. Now, tip for success number 2 is download and complete the outcomes and objectives and budget templates located below. Your organization will use these documents to save them to your computer and upload as supporting documents to the online application in questions 7 and 8. So this is the FY26 Community Benefit Objectives Outcomes template. So all you do is click and it can populate. You can download this to your computer. You'll input your organization name and project title, and then you'll list the objectives and measurable outcomes and the data source by which you'll use to track your objectives and outcomes. Now, as you're filling out this space, if the text that you include in this space goes further than what is seen in this fillable space, not to worry. We will copy and paste this information from this PDF into a reviewing system. So if you have several objectives or explanation for a single objective that goes further than the view of this one space, not to worry, your information will be captured and used when we are reviewing the application. And the community benefit budget template, if you click this, this is a template that we've prepared for you. Again, include your organization name and project title at the top of the page. And then you can go ahead and include a description of what your project expense is in this left column. And then in the right column, your the cost auto-populates, auto-sums at the very bottom. So again, it's a $12,500 grant. So your budget must reflect a $12,500 budget. So for example, you can see here, if I type in 5,000 auto-populates here. And if you were to do another 5,000 or something else, it'll auto-populate. And then if you were to list 2,500, it'll auto-populate to 12,500, which provides an easy accounting for you. It is your task to then identify the project expenses and align it with the amount to be supported by the grant. So once you've completed your project budget template, as well as the objectives and outcomes templates, you can save those to your computer and have those ready to go as supporting documents to questions 7 and 8. And so now that you've completed all of the pre-application action steps above, you are ready to start the online application. Again, this is just some instructions of what you'll need to do. You will select which hospital you are applying to. You will select which priority health needs your project will address. You'll select which communities the project will focus on. You'll respond to the applications accordingly. Remember, there are a 2,000 character limit, spaces included. This is where that application tool will come in handy because you will already have your application responses ready to go. You'll upload the objectives and outcomes template into question number 7. You'll upload the budget template into question number 8, and then you will submit the form. Upon submitting the form, you'll receive a confirmation message. If you require a copy of your submitted application, please submit your request to communitybenefit@memorialcare.org, and we will get back to you as soon as possible. So before we jump into the application, which is right here, I want to point out where the community health needs assessment and implementation strategy are listed on our website. So here at FY25, if you click this drop down, These documents are the full community health needs assessments for each of the MemorialCare hospitals. And this is the implementation strategy for each of the hospitals, which includes the prioritized health needs for each hospital. So for example, if you were to click into one of the implementation strategies, you see here the prioritized health needs for this hospital. And the full strategy and context behind the implementation strategy is listed here. And the same would apply for the 3 other hospitals, in addition to the community health needs assessment. So those are listed on the website. They are just right below the application itself. So now that you've received instructions on how to complete the application, what information you'll need for the application, and where to find our implementation strategy and community health needs assessment, we will go ahead and hop into the application itself. So you'll go ahead and click this Start Application button. And this here is the online FY26 MemorialCare Community Benefit Grant application. You'll input your organization name, your organization address, your organization's website, your tax status, whether you're a 501c3. You'll include your tax ID number, so it's a 9-digit EIN number. Do not include any spaces or dash. You'll provide your contact name, your title, a phone number, and an email address. This is very important. So if there is an email address that our organization can contact, that maybe you have a grant writer, or you have a public domain email address that your organization can use in case someone leaves your organization. We want an email here for our purposes of following up with you with an approval or decline later this year. So this contact information is very important for us to be able to reach you later in the year. And then this is where you will select which hospital community benefit grant program your organization is applying for. So you will select one hospital from this drop-down list. So you click this drop-down caret, and you can select either Miller Children's and Women's Hospital, Orange Coast Medical Center, Saddleback Medical Center, or Long Beach Medical Center. In this example, we'll go ahead and click Miller Children's and Women's Hospital. Automatically, the priority health needs that align with the Miller Children's and Women's Hospital are populated here in this dropdown. So it could be access to healthcare, behavioral health, chronic diseases, pregnancy and birth outcomes, and/or preventive practices. You can select all that apply. So perhaps your organization has a project that is revolving around pregnancy and birth outcomes and access to healthcare. You can select both of those priority health needs. In the next dropdown, you will select which hospital service area your project will focus on. And so we have all of these cities that we identified in the table for the hospital service area, which you will select. So you can select all that apply if you're going to serve in South Los Angeles, Wilmington, San Pedro, Linwood, Paramount, Southgate. You can select all that apply for the service area space. Again, you'll have your project title, your project summary. You'll go ahead and provide a description of how the grant funds will be used. For number 4, you will describe how your project addresses health equity in the community. We're asking you to identify the underserved, underrepresented, and/or vulnerable populations who may be helped through this project. So if there's by age, race, and ethnicity, gender, socioeconomic status, or other demographics, we want to know how your project is reaching this underserved and underrepresented and/or vulnerable populations in the community. Number 5 is we ask for an estimated number of people who will benefit from the project. So if it's 100, if it's 500, if it's 50, just go ahead and indicate a number there just so that it aligns with your project objectives and outcomes. And we also ask how your project will address social drivers of health in the community. Now, question number 7, as we shared previously, this is where you will have the objectives and outcomes document that you have downloaded and saved. You will just drag and drop it into this space here. And then again, with the budget template, which you've downloaded already and completed, you will drag and drop it into this space here. Now, if you have any grant program questions, you can include them here in question number 9. And then you can submit your application. So if you have any questions, you can provide them here, and then we will receive it upon review. And each of these questions that are designated with a red asterisk means that they are required responses for the application. So once you've uploaded documents by a drag and drop into this field, and you've completed each of the open questions and items that we've asked you to choose from regarding the service and the priority health needs, in addition to your hospital and contact information, you will be able to successfully complete your application. You will receive an automated message, as we shared, that indicates that we received your application, and the approval and decline letters will go out. Again, that's November 3rd, 2025. And if you have any questions, you can reach out to Melissa Beal or Ronique regarding the applications themselves. If you want a copy of your application, you can also email communitybenefit@memorialcare.org, and we'll get back to you as soon as possible. Again, on behalf of MemorialCare Health System and each of our hospitals, we thank you for the work that your organization is doing. We wish you the best success for submitting the application. And if you have any questions, please feel free to reach out.